Well, joining us now, Dr. Soumya Swaminathan, Chief Scientist of the World Health Organization. Thanks very much, Dr. Swaminathan, for joining us. My first question to you, ma'am, will the vaccines which we now have give us protection against this new mutation?
Thank you, Vishnu. I think your question is very pertinent, and I think everybody's interested and worried about what's going to happen about vaccine efficacy. But I think it's too early to really conclude either way. What we do know is that the number of mutations, the number of changes that has occurred in this particular variant is larger than normal. So there are about 22 or 23 mutations which have occurred, and several of them are in the spike protein region, as you mentioned. And that's the region, that's the protein that's being targeted by most of the vaccine developers, at least in the first set of vaccines that are coming out. But it's the vaccines, that the spike protein itself that's part of the vaccines would generally elicit quite a broad immune response, both a neutralizing antibody and a cell-mediated immune response. And it would be unlikely that a couple of mutations in the protein would actually change the response of the immune system to the vaccine. So while we have to wait, and the investigations, the lab experiments that are going on now that are taking this virus in culture, adding serum either from recovered patients, so convalescent sera, or serum collected from vaccine recipients to see if this virus can be neutralized by the antibodies that these people have. Those experiments are going to take a couple of weeks for us to get results and would definitively tell us the answer to this question.
Dr. Swaminathan, is it possible that the travel ban which we now have, which probably makes a great deal of sense for so many countries around the world, could in fact last for several months? The reason I ask is it's at a stage like this when you want people to be vaccinated as soon as possible with the hope that the vaccine does work. And until the United Kingdom brings down its rates, then would it be safe to open up travel to the UK? And to bring down the rates in the UK would take time. That's the key issue. You can't have it overnight. It would take a few months. So could this be a protracted travel ban?
So a couple of things I'd like to say in response to that. The first is that we're going to learn more about this strain in the coming days and weeks. So the questions that we're interested in is it more transmissible? Does it, infect, go from person to person much more easily? Does it result in worse clinical outcomes? Is it more severe clinical disease? And thirdly, does it have an impact either on treatments like monoclonal antibodies or vaccines? So we only have a hint about the first question. The UK scientists who've done a lot of modeling around this, and you showed the explosive growth of this variant in the southeast of the UK over the last few weeks, suggests that it's more transmissible. But there have been mutations in the past which have also become the dominant variant going forward. So it may be just another variant that has an advantage in spreading and therefore becomes a dominant strain. So I think we need to wait for those. But on the travel, the first thing I'd like to say is that the UK is one of those countries that's doing a lot of whole genome sequencing and therefore is able to track this, very closely in real time. I suspect that as more countries look at their whole genome sequencing data, and we encourage countries to do much more sequencing than is being done now, that many more countries might find that this variant or related variants might already be in the country. Several European countries have already reported the presence of this variant. And because it's been in circulation since September. So it's likely to have spread internationally. And I think the more we look, the more we will find. The other important point here is that whether it's this variant or another variant, the public health measures are the same. And it's really important that all countries now put in place measures to control this virus and bring down transmission to as low levels as possible. And we know what those measures are, the testing and the tracing and the quarantining and the isolation of the positive cases. So those measures need to be put in full, place regardless of which variant it is.
So Dr. Swaminathan, tell us a little bit about sequencing. Some countries do it a lot more than others. How much time would it actually take for countries sequencing with the best equipment available to actually know about the variant or the strain of the virus? How long does it take?
Doesn't take long at all. So countries that have the capacity, India, for example, is a country that has huge capacity to do whole genome sequencing. We have labs across both in the private and the public sector that are doing it. In fact, India is contributing quite a lot of sequences to this global database called GISAID,
Yes.
which currently has close to 300,000 whole genome sequences. Several parts of the world are underrepresented. Asia is relatively underrepresented, and so is Africa. So a lot of the sequences have come from North America and Europe. So I think the more that these countries are able to do and deposit in this database called GISAID, the better. Because this also allows scientific collaborations globally and scientists to work on looking at how the virus is really evolving and changing over a period of time. And you can, many countries have used sequencing to understand their epidemiology, to understand where the infection and when it entered their country and how it has actually spread and where the clusters are and whether there are any dominant strains, that are coming up over a period of time. What we need is a national database.
Right.
We have a global database, but it would be also good to have like a national database of whole genome sequences where all the agencies come together and collaborate and work together to track how this virus is behaving in India.
All right, Dr. Swaminathan, thank you very much for joining us. Sequencing is so important now as we go ahead and try and fight this, but the basic measures need to remain the same to protect all of ourselves.